Imagine a sturdy wall with a weak spot. Over time, this weak spot can become more pronounced, leading to a visible crack or even a hole. That's what happens in a hernia. It's like a small defect in the wall of your abdomen that can grow larger if not addressed. Inside our bellies, we have a strong wall of muscle and tissue. This wall is designed to keep everything in place, providing support and protection to our internal organs. It holds our organs in place, ensuring they function properly and stay where they belong. A hernia is a weakness or hole in this wall. This defect can be caused by various factors such as heavy lifting, persistent coughing, or even genetic predisposition. This weakness allows an internal part, like your intestines, to bulge out. When this happens, it can create a noticeable and sometimes painful protrusion. Imagine a balloon pushing through a hole in a box. The balloon represents your intestines, and the box is the abdominal wall. When the wall is compromised, the balloon pushes through, creating a bulge. This bulge can create a noticeable lump or swelling. Depending on the size and location of the hernia, this lump can vary in size and may become more prominent when you stand or strain. Hernias can be painless or extremely painful. Some people may not even realize they have a hernia until it becomes more severe, while others may experience significant discomfort and pain. They can occur in different areas of the body. Common types include inguinal hernias in the groin, umbilical hernias near the belly button, and hiatal hernias in the upper stomach. Understanding hernias is crucial for early detection and treatment. If you suspect you have a hernia, it's important to seek medical advice promptly. Early intervention can prevent complications and improve outcomes. Treatment options vary from lifestyle changes and monitoring to surgical repair, depending on the severity and type of hernia.
Hernias are categorized by their location in the body. They occur when an organ or tissue pushes through a weak spot in the surrounding muscle or connective tissue. Understanding the different types of hernias and their specific locations can help in identifying symptoms and seeking appropriate treatment. Each type has unique characteristics and affects different parts of the body. Knowing these distinctions is crucial for proper diagnosis and management. Inguinal hernias. These are the most common type of hernia, appearing in the groin area where the thigh meets the lower abdomen. They occur when a part of the intestine protrudes through a weak spot in the abdominal muscles. Men are more susceptible to inguinal hernias due to the natural weakness in the groin area. Symptoms often include a bulge in the groin, pain or discomfort, especially when bending over, coughing, or lifting. Femoral hernias. These also occur in the groin area but are located lower than inguinal hernias. They happen when tissue pushes through a weak spot in the muscle wall of the femoral canal. Femoral hernias are more common in women, particularly those who are pregnant or obese. Symptoms can include a lump in the groin or inner thigh, and discomfort or pain in the groin area. Umbilical hernias. These occur around the belly button, or umbilicus, where the abdominal wall is naturally thinner. They happen when part of the intestine protrudes through the abdominal muscles near the navel. Umbilical hernias are common in infants, especially those born prematurely. However, they can also affect adults, particularly those who are overweight or have had multiple pregnancies. Symptoms include a bulge near the belly button, which may become more noticeable when the person is crying, coughing, or straining. Hiatal hernias. These are different from other types of hernias as they occur when part of the stomach pushes up through the diaphragm into the chest cavity. This can lead to gastroesophageal reflux disease, GERD, and other symptoms like heartburn, difficulty swallowing, and chest pain. Incisional hernias. These develop at the site of a previous surgery. They occur when the tissue around a surgical incision becomes weak or thin, allowing an organ or tissue to push through. The weakened tissue from the surgery makes a hernia more likely. Symptoms can include a bulge near the site of the surgical scar, pain, and discomfort, especially when lifting, coughing, or straining. Proper post-surgical care and monitoring are essential to prevent and manage incisional hernias effectively.
Hernias are classified by their severity and symptoms. Reducible hernia. You can gently push the bulge back into place. Irreducible hernia. The bulge can't be pushed back, often causing discomfort. Strangulated hernia, blood supply to the bulging organ is cut off. This is a medical emergency. Symptoms can vary. Some people experience a painless bulge. Others have pain, especially when lifting, coughing, or straining.
Not all hernias require immediate surgery. Lifestyle changes and watchful waiting may be options. Observation. Your doctor might monitor the hernia if it's small and painless. Lifestyle modifications. Avoid activities that strain the abdominal area. Maintain a healthy weight to reduce pressure on the abdomen. Pain management. Over-the-counter pain relievers can ease discomfort. Your doctor might suggest other pain management techniques.
Section 5. Surgical repair, when it's necessary. Surgery is often the best option to fix a hernia. The decision depends on the size, location, and symptoms. Open surgery is a traditional approach with a larger incision. The surgeon repairs the weak spot and reinforces it with mesh. Laparoscopic surgery is a minimally invasive technique using small incisions. A tiny camera guides the surgeon, allowing for a faster recovery time.
Section 6. Navigating hernia surgery, what to expect. Hernia surgery is usually an outpatient procedure. You'll receive anesthesia. The type of surgery determines the recovery time. Pre-surgery, your doctor will give you specific instructions. This may include fasting, medication adjustments, and bowel preparation. During surgery, the surgeon will repair the hernia and strengthen the abdominal wall. Post-surgery, you'll wake up in a recovery area. Expect some pain and discomfort, which can be managed with medication.
Section 7. Post-operative care, your roadmap to recovery. This section is designed to guide you through the essential steps you need to take after your surgery to ensure a smooth and successful recovery. Proper care after surgery is crucial for healing and preventing complications. It's important to follow your healthcare provider's instructions closely to avoid any setbacks. Pain management. Take pain medications as prescribed. Managing your pain effectively will help you move more comfortably and speed up your recovery process. Don't hesitate to discuss any discomfort with your doctor. Open communication is key to addressing any issues that may arise during your recovery. Incision care. Keep the incision area clean and dry. Proper incision care helps prevent infections and promotes faster healing. Follow your doctor's instructions for dressing changes. Make sure to change your dressings as often as recommended to keep the area sterile. Activity. Restriction. Avoid strenuous activities, heavy lifting, and straining. Overexerting yourself can lead to complications and delay your recovery. Gradually increase activity as advised by your doctor. Gentle exercises and walking can help improve circulation and prevent stiffness. Diet. Start with light, easily digestible foods. Your body needs proper nutrition to heal, so focus on eating balanced meals. Drink plenty of fluids to stay hydrated and prevent constipation. Staying hydrated is essential for your overall recovery and helps your body function optimally. Rest. Ensure you get plenty of rest. Your body needs time to heal, and rest is a crucial part of the recovery process. Follow-up appointments. Attend all scheduled follow-up appointments. These visits allow your doctor to monitor your progress and address any concerns. Emotional support. Lean on your support system. Recovery can be challenging, and having emotional support from family and friends can make a significant difference. Patience. Be patient with yourself. Recovery takes time, and it's important to give your body the time it needs to heal fully. Remember, your roadmap to recovery is a journey. By following these guidelines and working closely with your healthcare team, you'll be on your way to a successful recovery.
Section 8. Lifestyle adjustments after hernia surgery. Long-term lifestyle changes can prevent hernia recurrence and promote overall health. Maintain a healthy weight. Losing weight reduces pressure on the abdomen. Eat a balanced diet. Focus on fiber-rich foods to prevent constipation. Quit smoking. Smoking weakens tissues and hinders healing. Practice safe lifting techniques. Lift with your legs, not your back. Section 9. Prevention and long-term outlook. While not all hernias are preventable, certain measures can reduce the risk. Maintain a healthy weight. Excess weight strains the abdominal wall. Strengthen core muscles. Strong abdominal muscles provide better support. Avoid heavy lifting. If you must lift, use proper form. Eat a high-fiber diet. Prevents constipation, which can strain the abdomen. Section 10. When in doubt, seek medical advice. Hernias can be uncomfortable and potentially dangerous if left untreated. Don't ignore symptoms. See a doctor if you notice a bulge, pain, or discomfort. Early diagnosis is key. Prompt treatment leads to better outcomes. Open communication is vital. Discuss your concerns and medical history with your doctor.